Hi, it's Paige again. How are you? I hope you're doing well. I'm doing great. I promised you that I would make another video when something significant happened in my transition, and last Tuesday on the 19th, I had breast augmentation surgery, and I thought I should share that with you and perhaps give you some insight, at least as to my experience. I'm sure that not everybody's experience will be or has been the same as mine. But I do want to share this with you because I know it's an important step toward a total transition. My HMO at Denver Health is going to cover my bottom surgery, but they don't cover top surgery any more than they would for any other natal female in the absence of breast cancer surgery. If I'd had breast cancer, they would have done reconstructive surgery on me and I would have been fine. But I'm not sure. I've been told and believe that breast augmentation surgery for trans women is somewhat different than for natal females because as an adolescent male, my chest expanded and got broader than a woman's would. And so the placement of to have the best result, the placement of the implants needs to be done a little bit differently, or perhaps just where they're placed. I really don't know, but I chose a doctor here in Denver who has done a number of transgender women. He also does some facial work, but he's mainly known as a breast doctor, and the vast majority of his patients are genetic females, both for augmentation and for breast reduction. Anyway, I chose a doctor named Dr. Murphy, Terrence Murphy. He works out of his office down is part of the Swedish hospital complex in South Denver. And I'd always known that he was going to be the one I chose unless I chose to have breast augmentation done at the same time as my bottom surgery, which my friend Danielle did do. But I didn't want to have all of my limbs incapacitated or sore or suffering at the same time. And so even though it probably cost me an extra $1,000 or so to do it this sequentially, that's what I chose to do. I called the doctor's office, I think, just before Christmas, thinking, I'd get an appointment a couple months out, but they said, nope, we can make all your appointments right now. And they did, so I believe it was late in December, after Christmas, I went in for my consultation, and that took over an hour. The first stage of the consultation was one of his people asked me questions, took my history, and then the doctor came in and talked to me for probably 15 minutes just about myself and what I was doing and so forth and so on. It was very nice. And then we went to an examination room and he examined my breasts and told me that I was lucky because I had well-developed breasts. And I don't think he meant they were big. I think he meant that besides the glandular growth that I'd had fatty accumulations around, under my arm, and just I had a well-formed breast, he said. And because of that, when we went into his office to talk about which kind of implants I should get, he recommended an implant which was actually less expensive than what I thought I wanted. I thought I wanted gummy bears, which is the silicone that you can cut with a knife and it doesn't run or anything. But he showed me that the other silicone implants, which were cheaper, didn't really run either. So I saved some money there. And we also did a fitting. I put on a sizing bra and I actually put different size implants under that bra on top of my own breast to see how big I thought I wanted to be. And at that time I chose 375 cc's of silicone in each breast. They don't do it by cup size, they do it by cc's. He says, I don't know what cup size you'll end up as or how you'll be fitted, what cup size you'll be fitted to. I'm more interested in that you are comfortable with the shape and the size of your breasts. So I picked 375. He then sent me a packet like this, which is full of pre and post care and release forms and things like that. And in one of the release forms, he said that he reserved the right to increase the number of cc's based upon his evaluation, because the implant would be placed under the muscle, and therefore there would be a flattening effect. And so I went back from my pre-operational appointment where they did lab work. I had to give them blood. They did my blood pressure, just pretty simple stuff. And we talked again about the surgery, and they gave me my prescriptions for the medications I needed to take before and after. And the doctor again came in and sat down and wrote down that he would put in 400 cc's. But in fact, he didn't. He put in something slightly bigger. He made that judgment during the surgery, and I'm so glad he did, because I don't know what I'm doing. I could have said, give me 800 cc's and been unhappy. He knows what it's going to look like much better than I do. So I tended to trust him. I had to trust him. So anyway, there was really no prep other than taking 2 anti-inflammatories before I went to bed the night before, and not drinking or eating anything after midnight. My friend Danielle drove me to the doctor's office and waited during the surgery. It was very simple. The anesthesiologist came in. It was done at the doctor's office. He has a small surgical suite there where he can do simple procedures like this. And the anesthesiologist was great. I remember nothing of the surgery. My memory of right after the surgery is sort of blank too, because I remember leaving and I remember getting home. I don't remember the drive home, but I did the next morning when I looked at my materials. I saw that he had put in 425 cc's, and he said he thought that's what I needed. So the recovery was amazing. He had given me painkillers, anti-inflammatories, antibiotics, some Valium, which is a muscle relaxant in case I got muscle spasms after the surgery. And he also gave me some suppositories, which I could use if I was suffering nausea from the anesthesia and wasn't able to eat or anything. So I actually only took pain pills for the first day, and it was all I needed. The next day I could actually raise my arms up like this, and on Wednesday, I actually on Wednesday drove myself to his office for the post-operative appointment, where his nurse basically just looked briefly at the incisions to make sure that they weren't weeping and losing too much fluids and stuff like that. Not that fluids would not have been silicone, they would have been, they inject additional local anesthetic into your breasts after the surgery is complete, and then also there was some blood and stuff that could be weeping out. And I did have a little bit of weepage or seepage that night, but it was mainly probably the local anesthetic. But I really was fine, and was able to live a pretty normal life this week. I didn't work. I planned to take off the remainder of the week, and I did. But I was able to drive my car. I was able to go out to dinner with friends. I went to my fellowship meetings. It really was much easier than I expected. So when I woke up, when I got home, let's say, became aware of what I had on. I have on a thin cotton bra that's pretty thick in terms of height, and goes a couple inches underneath my breast, and it's not a pressure bra like a sports bra, but it's a tight-fitting thin cotton bra. And then this, what you see here, is a Velcro bandage, stretchable like an ace bandage, which they put at the top of my breasts to help them settle, because when they put them in, they're high, and they want them to settle down into a more normal natal female conformation as and as the swelling goes down. So they want them down, and so I'm supposed to wear this bra and this Velcro thing, which is actually quite comfortable all the time until I go back in a week from tomorrow, when the stitches will be taken out, and from then on I believe I can wear a normal bra, and I'm looking forward to that. I'm looking forward to finding out what size I am and being able to buy some of the more feminine bras that I haven't been able to wear before, when I've had to use forms to give me an appropriate female posture. So I'm going to step back just for a minute to show you what I look like. So I really don't look very much different than I did before. I think they are going to be a little bit larger than I did when I was wearing just those little, what we call around here, chicken fillets inside of my bra. I was a C cup before, and I think I'll still be a large C or a small D. But it's had a much greater impact on me than I thought it would. The fact that I am, well, I'm not completely am, but I'm more am now than I was before, gives me more confidence. And having this done now also has made me more confident than before, which I was always confident, but much more eager, let's say, to have the bottom surgery done. I do have a date for my bottom surgery. It's in early 2017, so it's over a year away, just about a year away. I do expect to move up in time because I'm on the cancellation list. That's going to be with Dr. Marcy Bowers in California, and my authorization from my HMO will be completed this month, and so I'm going to have to start dealing with some of the hair removal that you need to do for bottom surgery to prepare the site. And I'm hoping to be completely ready to go by the end of June or sometime in June, with the goal of having my surgery late this year. And having my breasts has confirmed to me how important it is that I look like a woman to myself at all times, and how affirming it is. And I'm so very grateful that it went well and that I'm able to do this. So I do know from, I'm working at Denver Health as an LGBTQ patient navigator, so I'm talking with lots of doctors and lots of people in the community. And I know that the waiting list for bottom surgery has grown significantly. I was told as much as 3 years now. So if any of you are thinking that you want to get bottom surgery, perhaps it would be wise to select your surgeon and contact them and find out what it needs to do to get on their list. Usually it'll probably require some minimal deposit, but something to get on the list, because you'll have plenty of time to work out the details. When I got my reserve date, the waiting list was 20 months long. And so I've been told it's 3 years now, and I can believe it because many more insurance companies and Medicaid, in Colorado at least, are starting to cover that. So life is great. It really is. And I'm very happy with the girls, and my genetic girlfriends in the fellowship all say that he was perfect. They said that's exactly the right size. When he came in, this is funny, when he came in just before the surgery, Dr. Murphy said, now you know the 3 sizes of breasts. He says, they're the breasts that you have that when after somebody's met you for 5 minutes, they go, nice breasts. And then there are breasts that when that people have, women have, that when men meet them, the very first thing they say is nice breasts. And then there's the breasts that some women have that when you walk into a room with another crowd of women, a group of women, the men say, wow. And he said, I think you're going to be in the first category. And I said, well, that's about right. And I think that's where I am. And that's where I want to be, because I do want to fly on the radar. I don't want to draw too much attention to myself, but I want to look like a woman. So anyway, this is a long video, and I hope everybody's doing well. I'll keep you informed of any progress or steps in preparation for the bottom surgery, and I hope everybody is taking care of yourself. You know, see a doctor. Let them know what's going on in your life, and there are many, many doctors there that are very transgender friendly. I'm finding out. I'm surprised more and more in this job I have, how many of them want to treat transgender patients. So God bless everyone, and thank you. Bye-bye.